Good Wednesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is for our healthcare providers. We are thankful for the many amazing providers in our community who have stepped up to the plate to provide care in a safe and thoughtful manner. Hospitals, clinics, doctors' offices remain safe places to go, so we urge everyone to not delay seeking care if you are in need. If you are still concerned, call ahead to your provider and see what options they have for telemedicine. And remember to schedule your yearly physicals for yourself and your family. Preventive checkups are important every year, but especially now, it's even more crucial to check with your provider and get caught up on any necessary vaccines to protect yourself and your family. While we're on the topic of healthcare partners, our hospitals have asked us to reiterate the importance of wearing masks and abiding by their visitation policy when you come to their hospital campuses. This is to protect the vulnerable patients inside, other visitors, and their staff. And it's critical that the hospital staff stay healthy so they can continue to care for our community. Now we want to talk about yesterday's increase. This was the largest single day increase we have seen since the pandemic began. As we've said before, these large increases are concerning. So we want to talk a little bit about what we are seeing with recent cases, because it is a small change from what we've been previously seeing. While we are seeing some small clusters, many of our cases have no known exposures, which means they have no known contact to a previous case. This can be an indicator of community spread. Some of our cases are reporting going to social gatherings and group events, and they're not following the 5 core actions like wearing a mask and physically distancing. We want our community to hear this because it further stresses the importance of taking your health into your own hands and following the 5 core actions. These actions alone won't completely eradicate COVID-19 from our community, but they will help to slow the spread. We'll now move into our local situation. We have 734 confirmed cases of COVID-19 in Knox County. Additionally, we have 24 probable cases. 593 of our cases have recovered, giving us 136 active cases. 63 individuals have been hospitalized at some point in their illness, and 8 Knox County residents are currently hospitalized. And we are thankful to report we have no additional deaths due to COVID or complications from COVID-19. I'll now open it up for questions.
All right, please go ahead and type your questions into the chat feature, and remember to please type your name and the media outlet that you're affiliated with. The first question we have is from Alan Sims from inside of Knoxville. He says, several downtown restaurants have closed temporarily after finding potential exposure among employees. What is the guidance for restaurants or other businesses if an employee is diagnosed?
So we work with those restaurants and businesses. It's a team approach on investigating the case and the circumstances for potential spread within the organization and make recommendations based on that. Specifically, restaurants are considered critical infrastructure. This is according to the federal government. It's CISA, the Cyber Infrastructure Security Administration, has a list of what is considered critical infrastructure, and restaurants, being people that feed us, are on that list. So what that means is we talk to them, we make sure the case appropriately stays home in isolation, and we do all the things we always do with our cases. We identify close contacts within the facility, and then we talk about quarantine for those. Critical infrastructure employees can continue to go to work while they are in quarantine, but they have to wear a mask the whole time they're there. There's no give or take on that. No matter if you're social distancing or not, you have to wear a mask. You have to have your symptoms monitored frequently and actively checked and screened for symptoms. And they have to notify us if they develop any symptoms, and then they would have to stay home because they would be treated like a probable case. And we do the whole process we've talked about before. But it's definitely a discussion with the business. The business may choose to close if they feel like that's what's in best interest for them and their employees. And we completely support them if they choose to do that. Others will stay open following those guidelines. We also make sure that our environmental team is involved with that as well, and they talk with the facilities to make sure they're following the guidelines and do what we call an environmental assessment with them.
And his follow-up question is it different if they are exposed but awaiting test results?
As we've talked about before, quarantine for exposures to cases, it doesn't really matter what your test results are. There's still that 2-week window. And so even critical infrastructure employees that are allowed to go to work are still quarantined from all other activities. So they can be at home or work for critical infrastructure. And that time frame stays the same no matter what. So even if you get tested and those test results were to come back negative, you still have to follow the quarantine guidelines, because as we've talked about before, you can develop or you can become positive at any time during that 2-week window.
From Megan with WBLT, she says this question comes from a viewer. Can COVID-19 be spread through secondhand smoke? And if so, how far?
I've not seen any data on that. It's not listed as one of the modes of transmission that we're seeing right now. Again, this is a new virus, and that might change. That information could change in the future, but I've not seen any information on that from a body of evidence supporting it from CDC guidance and World Health Organization guidance to suggest that as a mode of transmission right now.
From Elise with WBIR, the state is calling 2 counties close to Knox County hotspots. Are you concerned that having hotspots close to Knox County could create bigger issues here?
Oh, as always, and we've talked about this a lot. The more cases that are happening in the community, whether it's our community or neighboring communities, is worrisome. And that's when we always go back to those 5 core actions, making sure that you stay home if you're sick or you've been asked to stay home, that you physically distancing at least 6 feet away from others. If you at all possible, making sure you're wearing your mask, washing your hands frequently, and disinfecting surfaces. But it's very concerning, and we're keeping an eye on it. And
her follow-up question there is specifically any concerns as it relates to hospital capacity.
We are looking at hospital capacity every day, and that does play in a role there. So when we look at, the daily numbers that I report for Knox County residents are Knox County residents at any hospital, and those are for our Knox County cases. Friday's benchmarks that we talk about are the entire region, all 16 counties that have 19 hospitals in them total. We look at the whole region for those benchmarks, and we will be looking at that, and any hospitalizations related in those counties will show up in that benchmark data on Friday.
From Claire with WUOT, is there any number of cases or a spike that could happen over the next 6 days that would prevent Knox County from moving from a custom reopening plan to the Tennessee pledge?
So that will be up to the Board of Health, and they'll be looking at all of our data next week during their meeting, and they'll make those recommendations of how they want to proceed.
From Jeff with WATE, the active case count went up yesterday, then down today by substantial amounts. Can you offer any further explanation on the change?
Yeah, that happens a lot. We might have had a cluster or a spike 10 days or more ago that had active cases coming in that are rolling off now. And not everybody rolls off right at the 10-day point. So if you're symptomatic with COVID and you've been symptomatic for a few days, we have to be 10 days plus 72 hours fever-free and improvement in your symptoms, all of those things. So it's not a hard cut line that every 10 days our new cases roll off. So it was just a group of cases happened to all roll off on the same day while we had others coming in.
From Vincent with the Sentinel, on the KCHD website, it says that we have 16 new cases today. Can you clarify what you meant when you said this was the largest daily increase we had seen?
That was yesterday's, was the largest daily increase. So it was, I believe, 36 cases yesterday. That was what I was referring to.
And then this question is, how many new cases have we seen today?
And today's the number that's on the website today.
From WBIR, Elise asks, the cases listed as hospitalized are just those who have Knox County addresses, correct?
For the daily report and up in the metrics, when you look at the blocks at the top of the website that have our daily case numbers and all of those things, those are just Knox County residents, people with a Knox County address. And they can be in any hospital. They can be in a Knox County hospital, or they can be in a hospital somewhere else. But it's Knox County residents. The benchmarks on Friday are what has the full region picture.
Also from Elise with WBIR, the most recent benchmark says that regional ICU beds are at 90% capacity. Is that normal or concerning?
That's actually pretty normal. Our hospitals do a fabulous job, and we're seeing more and more patients going back and getting checked and following up with surgeries and all the things that they had maybe been putting off. About a 90% capacity is normal for our hospitals, critical care systems, and they have plans in place to be able to, decompress or pull out more patients like they've demonstrated before if the COVID numbers were to start impacting their traditional care capabilities.
From Megan with WBLT, is 8 the highest number of hospitalizations reported so far in Knox County?
I think we've had 8 before, but we'd have to look back at that. I don't know for certain, but I'm pretty positive we've had an 8 before, but I'm not sure we've had more than that. We'll get back to that. Look back at the data and let you know.
Her follow-up question is, what could be contributing to the increased number of people who need to be hospitalized due to COVID?
There's a lot of factors there. I mean, all of the same things that put you at higher risk for complications still take effect here. And so your age, having other comorbidities like diabetes or obesity, lung disease, all of those things put you at greater risk of being hospitalized. So as we get more cases, we're going to expect, that percentage of hospitalizations will probably stay about the same. And so it could be having more cases and more people that are getting exposed. I'm not seeing a lot of evidence right now that we're in our data that there's, any changes in what we would expect to see in our hospitalizations.
From Elise with WBIR, cases among the Hispanic community are still growing pretty steadily. Mm-hmm. What outreach are you doing, and do you think what you've done so far has been effective?
We are continuing to work with the Latino community and leaders in that community. We're putting out videos regularly because we've been told that that's how the community prefers to receive information and get new information. So short videos with different topics. We are making sure that we got masks into organizations in the community to be able to help facilitate that. Just doing a lot of work. As far as right now, it takes a little while for messages to take, and we're sharing a lot of information on social media. I forgot that one as well. But sometimes it takes some time to see some change. And so we hope we do see some change soon. But we are continuing very much to keep an eye on and work with that. We need our partners to help get our messages out within the community. So if you are someone that's working with the Latino community and you have access to help share information and provide messages to them, especially as a trusted source, we ask that you share our messages, and those are available on our website. We have a YouTube channel for that. Lots of ways to help get messages to the community.
From Megan with WBLT, how would the health department advise, the questions jumped down there. How would the health department advise Knox County residents who are considering traveling to Sevier County as cases there continue to grow?
Be careful. And that we have community spread here as well, but wherever you're going, again, and I know it sounds repetitive and I know it's probably frustrating for people to hear, but we know there's plenty of evidence at this point to document that those 5 core actions we talk about all the time help reduce the spread of this disease, and they help protect you. And so please continue to do that, whether you're going to Sevier County or you're going out in town here or anywhere. Following those actions is critical to help slow the spread of this disease and protect yourself and your loved ones.
From Vincent with the Sentinel, according to state data, the largest increase was 37 on Monday. You've just said the largest increase was 36 yesterday. Was a Monday case transferred out of the county today?
Probably. So our case numbers are the ones we've talked about this previously. All the data goes into the state, and then for the reportable diseases based on their county, and then through our investigations, we find out if they're our case or they're not, all of those different things. There also could be a timing difference. So one of their cases that were counted on yesterday, maybe in our count today, or could have been in the day prior to that. It just all, there's a lot of different things, but we're confident in the numbers that we're providing to you each day. So 36 was our number for yesterday.
From Jeff with WATE, have we seen any cases at the county detention facility?
We have not at this time.
From Elise with WBIR, we're hearing from a lot of people who are concerned about someone working at a grocery store or restaurant testing positive. If someone hears about that happening and shopped at that store or ate at that restaurant, what should they do?
Let's talk about, again, what it means and what the main mode of transmission for this virus is: close personal contact. So within definition of 6 feet for more than 10 minutes. So generally we're not saying, and we're truly when we talk to cases, and that have known exposures, it's not those quick contacts. It's really that close contact, talking, laughing, social gatherings where you're spending a lot of time with each other that's really the risk. So not so much checking out at a restaurant or brief interactions in a business, that type of thing. Again, doing all the things that you can do as much as possible to protect yourself will go a long way as well.
Her follow-up to that was, should they be concerned or should they avoid that business for the time being?
You know, that's always a personal decision because, again, there's spread in the community, and COVID can be anywhere that we go. And so making sure that you're making those decisions on what's best for you and your health, no matter what, moving forward. So if it's something you're concerned about, then you don't have to go, then don't go. But, you know, everybody is empowered to make those decisions, and we encourage you to do that and to do everything you can to protect yourself when you're concerned.
From Brian Hornback, have all inmates at the detention facility and jail been tested?
That's a great question for the jail and the detention center. They would be able to provide you more information on that.
Yeah, and the same goes for that follow-up question there as well, Brian. From Elise with WBIR, what is your message to young people who continue to be responsible for the majority of the cases?
You know, you may feel like you're not at risk from this when you're young, and you're not seeing a lot of hospitalizations in that group and all of those things, but we want people to know to keep in mind that you can have this and not even be aware you have it. We do have asymptomatic people. We know that there's asymptomatic spread, and you come in contact with people every day that could be at risk from having serious complications from this disease, and be aware of that. And so please, again, follow those 5 core actions whenever you're out and about. Don't go to the big parties and events. Make sure you're social distancing, make sure that you're wearing a mask and doing all of those things to help prevent spread in the community. Because while it might not have a big impact on you personally, there's people in your life that it could.
Also from Elise with WBIR, for people who get really ill, how long does it take on average for someone who is sick to need hospitalization? In other words, given high new case numbers recently, when might we expect to see an increase in hospitalizations?
I'd have to go back and look at the data on that. We can answer the question, follow up with you on that. But it's typically, 5-7 days or more. I believe it's what the last data looks like that we when we reviewed that. So we're taking a note. We'll go back and see what that's looking like right now and follow up with you on that.
Any other questions, please go ahead and submit them into the chat feature now. All right, I'm not seeing any other questions come in, so thank you all for joining us today, and we'll be back with another media briefing on Friday at the same time. Have a good rest of your day.